everyone. My name is Shivani Shah, and I did my presentation on Emergency Medical Technician. It's also known as EMT for short. To begin with, what is EMT? EMTs are first responders to any medical emergency. So basically, when you dial 911, the dispatcher dispatches an EMT to come to your house. If any information is given, like, like my mom's bleeding, then the EMT knows to bring a lot of, like, gauze pads, or like more of like adapt to the situation. If they're not like aware of the situation, they still have a lot of supplies in the ambulance. They normally are like, they also respond to like car crashes, childbirth, violent traumas, heart attacks, any accidents that occur. And they stabilize the patients, and when they get onto the scene, transport the patient to the appropriate facility, and basically like take the patient to the best hospital possible, because some hospitals may not be able to do like the level of trauma that a certain hospital can. Like, suppose like a lot of head injuries are transported to town. Like, I live down south by like Trenton area, so when like a medical emergency occurs and some patient has like a really bad head injury, we're told to transport them directly to PA, because PA has Thomas Jefferson's. I don't know if you guys have heard of that hospital. It's very big in neurology, and like, they're like, we're asked to always bring them there because they specialize in that, basically. So this is a video just to give you a basic thing about EMTs.
Aha. And you thought it was going to be easy.
Like a very dramatic scene, but it basically shows you what EMTs do. So the basic responsibilities as an EMT is to evaluate a patient's condition. When you go through training, you're like taught like a series of like evaluations that to put patients in. So only like when you're transporting the patient, you can let the on-call doctor know that this person has this, so that doctor can prepare for that situation. Also, they determine like if like they try to ask the patients if they have any pre-existing conditions, or like histories, or like any drug abuse, or like just basically their general information. They're supposed to make any observations they see on patients. Like if they see the patient's skin is a little bit blue, they have to report that. So the doctors in like the healthcare facility they're taking to, they know what to expect. They supply stocks. They follow all the medical procedures and guidelines that are set by every state. Except, for example, in New Jersey, you need to have like a certain amount of gauze pads at all times in the ambulance, and like if you don't and you get pulled over by a cop, and like they can actually like get you in trouble for not having the right amount of gauze pads. It's like sometimes it's a little ridiculous, but like sometimes it's very necessary to respond to certain calls. They also need to make sure all the equipment in the ambulance is functioning or not. Also, a big thing is they need to decontaminate the ambulance every time a patient is in there. So after every use, it has to be decontaminated. And also, if a patient has like a contagious disease, they need to like take appropriate protocols. In this video, you'll see a basic ride-along.
In the morning, start off kind of slow, but once we come in, check off our ambulance, first thing we do is we come in, check off our ambulance, make sure everything's where it's supposed to be, got oxygen and all that, everything's working like it's supposed to. And then we let our dispatcher know that we're available for calls. Usually we have a little time to sit around when we first get here to talk to the other crews and see if there's anything going on that we need to be aware of, and then usually within a half hour of being available, we start getting calls. From then on, it's usually non-stop.
We are in ambulance 88. We are getting ready to pick up your patient at urgent care and take them to Winchester Medical Center. Before we get going, we're going to need you, if you feel up to it, to sign transport waiver. All it does is get your permission to transport you to Winchester. And then what we're going to do is we're going to get you on the back of the ambulance, and we're going to take a nice, easy trip to
EKG still looks good, no changes in it. Another 12 lead, it looks okay as well. Never had heart trouble before, right?
Nope.
No allergies, right?
No.
Excellent. We're out to your location with a 40-year-old male who came into urgent care with complaint of chest pain that lasted for a couple hours.
So that was basically a basic ride-along. As you can see, the ride-along was not that intense. Normally they would not record an intense ride-along because that's inappropriate. First of all, you should be concentrating on the patient more over like taking a video. So the education requirements of being an EMT is a 3-month course to a 6-month course. It depends on how you want to do it. I did a 3-month course over summer, 4 days a week, 9 to 12, or 9 to 1, and then like 3 to 7, and I was done in 3 months. If you want to do this course, like, you know, over like a period of time, their course is offered in St. Michael's at like, you know, during the night, like during like 6 to 9, so you could do it then. It depends on your schedule, honestly. A lot of those programs are flexible, but they do get filled up really fast, so like you need to act on it like, immediately once like the new schedule is produced. It normally takes around like 160 hours that I did. It depends state to state what their requirements are. So like as an EMT, you're the basic responder, so you know how to like respond to like fractures, bleedings, cardiac emergencies. However, if you wanted to do like IVs and everything, you would need to be like advanced EMT or paramedic. The salary, the starting salary is about like $14 an hour. People can earn up to $24 an hour. The annual salary rated was like 31 to 45K. It just depends on how many like, you know, hours and shifts you pick up, or like how many total, if you're like part-time or full-time too. And also they normally receive like healthcare benefits and like with a 401K. The job outlook for, according to BLS, is supposed to increase for EMTs, especially since a lot of the aging baby boomers, like they need like the medical help. They also like have a lot of higher call volume. Since like 2012, the call volume for my county has like doubled, which is very interesting. It just like sometimes there are a lot of unnecessary calls, like if like we had like a mom, she called in because her kid scraped his knee, and it's not that intense to call like, you know, an ambulance and everything. You could just take care of it on your own or something like that. I don't know if it's just maybe like a lot of people fear blood or something. Well, my experience as an EMT has been interesting. I did EMT because I wanted to do med school, and it gave me like that chance to like experience everything. So I had pretty cool experiences. The first, the top 3 that I remember really well, and I told today about them, is one of a lady. It was really sad, but it's funny at the same time. She's 30 years old. Well, now she's probably 33, 34, but she was 30 years old. She went to Syracuse art school, did a master's in it, wickedly smart, but she had some issue where she thought she was a 300-year-old Jesus Christ, and she was like blessing everyone, including myself. And like we were giving her water to drink, so she would like take the water and like, you know, splash us and be like, oh, now you're like holy and stuff like that. It was very like, it was very sad to see like she was so young and like she had such a bright future and like, but like the comments she was making, it was like you couldn't keep a straight face and you have to keep a straight face, like, you know, most situations. It's really sad, but at the same time it's really funny. Hopefully she's doing well, but like it's just sad to see like how like, you know, how, I don't know, like her whole mental condition was just like extremely like, I felt really bad. There was this guy who stabbed himself with a fork because the Packers lost. So like he was eating like chicken wings and he just like stabbed himself. And the funny thing is like he was really drunk and like he was still standing up straight. He was trying to take the fork out by himself and like my chief had to restrain him so he would not do it because like, you know, you could like tear like an artery or something up there.
It was in his head.
Yeah, it was in his head, like stabbed it. He's just like only because his team lost, mind you. And he was extremely mad and like cursing and stuff like that. And then there was this other drunk guy that we had. He lived on the 7th floor. He was really drunk and he just felt like skydiving. So he literally tried to skydive with like trash bags, and he tried to like fly, and he broke 13 bones, and he was like all mangled up, and it was really really crazy. I only responded to the scene second, like a backup, so a lot of like the band-aids were taken, but like I saw the pictures like his wife took and everything. They were pretty bad. Like you'll see a lot of people being stupid, but a lot of sometimes you see really cool stuff, like, you know, interesting stuff. It's I guess like a stepping stone job outlook for a lot of medical students, but now it's becoming into more of a profession for a lot of people as well. I think that's pretty much it.